Well, boy and girls, I've got a case here for you that's going to push your diagnostic skills to the limit.
What symptoms did you say we were dealing with here?
Glomerulonephritis, sinusitis, and 12-hydroxyicosapentaenoic acid, right?
So, what do you think it could be then? It sounds like a mix of renal and respiratory problems.
You're thinking too small. What this patient is really showing us is a case of Wilson's disease.
Wilson's. That's rare, Dr. Hawks. Are you sure?
Even if it were Wilson's, adrenalectomy seems like an extreme measure.
Nice. Wilson's disease is too in this conversation.
Look, I'm not asking for your opinions on this one. This is my case, and I'll be damned if that patient doesn't get the treatment he needs. Hey, Tracy, I wanted to talk about my patient with Wilson's disease.
What? You want to perform another one of your stupid surgeries?
No, it's not that, Tracy. We can help him if we do an adrenalectomy.
Hawks, I've told you time and again how much of a shit idea this is. Do you ever listen to me?
Only when you remind me that I left my wallet on your nightstand before heading to work.
Shut up, Hawks. You're not doing any surgery on anyone until I say so.
All right, Tracy. I get it. No more surgeries without your permission.
That's what I like to hear. Now get out of my office before you say something else that gets me pissed off.
I can't believe we did this to him. We had no business performing an adrenalectomy on a patient with Wilson's disease.
Come on, Randall. You know as well as I do that sometimes our hands are tied. Dr. Hawks was insistent, and in these situations, we have little choice but to follow orders.
What a terrible defense. Even if we tell Dr. Hawks we were following orders, he'll blame us for making up said orders to avoid blaming himself.
You idiots almost killed our patient due to your incompetence. Did you even check their liver enzymes before performing an adrenalectomy? You're lucky I'm not writing you up and sending you all to a medical conference on Wilson's disease. So stop asking me what the diagnosis actually is.
Hawks. We were just trying our best to help.
We did research on Wilson's disease. We thought that was the correct diagnosis.
But I guess you're right. Folks, we should have done more tests before jumping to conclusions.
And now I'm stuck having to deal with your mess while I try to enjoy my lunchtime. Just make sure this never happens again. And for goodness sake, let's get a new patient.
Why in the name of Christ would we get a new patient? We still have to figure out what's wrong with this one.
Because I assumed the old person was already a useful cadaver for the new one.
They're still alive, Hawks.
Then why are you mouth-breathing in my direction? Treat your damn patient! Well, Johnson, I see you've been quite busy with your oncology department.
Oh yeah, it's been a bit hectic, but we're managing to make some progress. How about you? Anything interesting going on in neurology?
How should I know?
Because it's always a puzzle over there, I figured it had to be brain science.
My idiots think it's Wilson's disease.
What if we renamed it to Johnson's disease?
We would if the patient had the symptoms of being a yapping pain in my ass who serves no greater purpose than small talk at lunch.
Unfortunately, the patient is an unconscious pain in my ass.
I've known about Wilson's disease all along.
The same one you said was wrong earlier?
You really should have told us sooner, Hawks.
Yeah, we would have been able to plan for this better with your information.
I know I shouldn't have come in without proper equipment, but Wilson's disease was the wrong diagnosis all along.
Wilson's disease. What makes you say it was incorrect?
That's a good point. Can you explain why you think that is, Hawks?
We're open to your ideas, but we need more evidence than just your lunchtime conversation with Dr. Johnson.
During my lunch with Johnson, I realized the patient didn't have Wilson's disease at all. It was ichthyosis bullosa of Siemens.
Can you tell us what the prognosis for that is?
Sure thing. Well, guess who finally got it right?
You are the one who admitted you were wrong, Hawks.
Right diagnosis at last. No thanks to my idiotic team.
What does that mean? You're talking about yourself here, aren't you, Hawks?
Just saying it wouldn't have happened if I had a better team of idiots like yours.
I don't even have a team.
That's the problem. You think you're a leader when you're really just a paycheck earner in a red blouse.
I'm not sure what that's supposed to mean.
I wouldn't expect you to.